So how do we treat these children? First, there are two parts in treating a nephrotic syndrome. One is treating the edema, one is treating the proteinuria which is there. So to treat the nephrotic syndrome, first we have to do is plan to start on steroids. So before we start the steroids, we have to mandatorily do a Mantoux test and make sure it is negative before starting the steroids. And in our case also we have done a Mantoux which has come negative, and we have started on the oral steroids, that is ISKDC guidelines regime, that is 2 mg per kg per day for 6 weeks because it's the first episode, followed by 1.5 mg per kg per day alternate day for another 6 weeks. That is the steroidal treatment. Coming to the edema, we have to first give diuretics and see the response for the edema. If the edema is still persisting, then we go for albumin infusion. In our child, we had given almost 6 albumin infusions and still we have not found that there is improvement in the edema. So in that case, we have done the peritoneal dialysis. So in coming to the peritoneal dialysis, we are creating a osmotic gradient, because of which the edema is with the osmotic gradient we are encouraging the ultrafiltration through the peritoneal dialysis, through which we can treat the child. So first we will treat it. Once the edema is better, we can discharge the child on oral steroid and ask them to come for a regular follow-up. Coming to the hypertensive management, first is the dietary restriction, that is a salt restriction, and along with that anti-hypertensive medication to be added. So we add one anti-hypertensive medication, we see the response with that, and then go to the maximum doses, then only add on to the other anti-hypertensives. Okay. There is regarding the infection which we have spoken, that is the empyema. We have drained the empyema and put the ICD for it to drain, and we have also added on the appropriate antibiotic for the treatment. So what we see is, until unless the infection is controlled, there is no response to the nephrotic syndrome, because we all know that infection triggers the nephrotic syndrome. So until unless the infection is cleared, our response to the steroids will take some time. Okay.